5 years after the invasion, and Iraq's healthcare system remains in crisis. Hospitals like this one of the biggest in Baghdad, have to deal with the aftermath of bombs and shootings on a daily basis. It's very hard for doctors to do their job. They often lack basic equipment and the necessary drugs to treat the injured. And many healthcare workers have been murdered or kidnapped. One doctor joked about his situation.
I will make the surgery for you on Sunday if I'm alive. And if I die, God bless you.
The security situation also makes it difficult to tend to patients with non-combat related injuries. Here they're treating 8-year-old Ali, hurt in a car crash. When we make a visit to another Baghdad hospital, it's pretty clear that specialist medical care is severely limited. I'm in the only specialised heart hospital in all of Iraq. At one point they used to carry out 8 open heart operations here every single day. Yet since the US invasion, this hospital has been looted and set on fire, and many of its surgeons have fled the country. The man who ran this hospital 5 years ago is one of those no longer in Iraq. We met him in a neighbouring country.
They started to nominate popular doctors, famous doctors and scientists, right? And either kidnap them, or kill them, or delivering a letter to them, warning them that they have to leave. And that happens with me, with my colleagues and everybody. Either be kidnapped and then he paid the money for that, or be killed, or they leave an envelope with a letter, sometimes with a bullet.
Back in Baghdad, the hospital he used to run now only has 150 beds. The other 100 beds were in this block, torched but never rebuilt. In the paediatric ward, we hear 2 harrowing stories. Rasoon Majid tells us that the surgery her 7-year-old son Taha needs to save his life can't be carried out in Iraq. Her husband is missing. She believes he's been taken captive, and she can't afford to send her child abroad.
He has very strong pains in his chest and can't sleep. He has to sleep on a high pillow in order to be comfortable at night.
In the next bed, a 2-month-old baby boy, Kumail Mustafa. His mother says he too needs surgery outside Iraq, something she can't pay for. We can't stay in a hospital like this for long because of security concerns, but in the 45 minutes or so that we've been here, I've met some people in desperate need, and just as I was leaving the hospital, one of the lab technicians came up to me and said that he feared for his life and asked me how he could apply for political asylum. James Bays, Al Jazeera, at the Ibn Bitar Hospital in Baghdad.